right, now I'm going to inspect the head for its size, shape, configurations. I want to make sure there's no lesions in his scalp. The shape is normal. The size is normal. He doesn't have any involuntary movements when I'm looking at him here. See any trauma to his head. I don't see any lesions or infestations, and that was what I would be looking for. Also, I'm going to inspect his face for symmetry, features of movement and expression and skin condition. Is the expression appropriate for the situation? Yes, his expression is appropriate. It's not flat or inappropriate. I would also palpate his temporal artery for tenderness and elasticity. Abnormal would be hard and rigid. And I'm going to palpate his temporomandibular joint for range of motion and swelling or tenderness and crepitation. I'm going to place my index finger over each and ask him to open his mouth. So, open. There we go. Does any of that hurt?
Nope.
Okay. Good. None of that hurts? Good. All right. Okay, now I'm going to inspect his neck while slightly extended position. Kind of hold your head up high. There you go. And I'm looking for symmetry, any kind of presence of lumps or masses, and all that looks symmetrical on both sides. Inspect or swallow the movement of the thyroid gland. So I'm going to have you sip a little sip of water, and let me watch you swallow. And that looks good. No asymmetry to that. Also, I'm going to inspect your cervical vertebrae. I'm going to flex your neck for me. Straight up, there you go. And I'm just going to feel down. All right. Now I'm going to inspect your range of motion. I'm going to have you turn your chin to the right. All right. Turn it to the left. All right. Now I want you to touch your ear. Turn it back to the middle. I want you to touch your ear to your shoulder. All right. And let's do the other shoulder. All right, I want you to lift your chin to the ceiling, and I want you to put your chin on your chest. Very good. All right, now I'm going to palpate the trachea. I'm going to place my fingers right around the sternal notch, and I'm feeling for each side, and I'm palpating the tracheal rings. Also want to palpate the thyroid gland. So I'm asking you to sit up very straight, and I want you to tilt your head slightly forward and to the right. I want you to relax your neck muscles on the right. And then with my fingers, I'm going to push his trachea slightly to the right. I'm going to curve fingers and trachea, and I'm going to get you to swallow. All right, his thyroid moves up and down, and it should. And I can follow it with my finger as he swallows. Let's do the reverse, and I'm going to get you to look the other way. Okay. All right. And swallow, and it moves up and down. No enlargement, no inconsistent on symmetry, and no tenderness, right? When I touch? Good. All right, so now I'm going to auscultate your thyroid gland for bruits with the bell of my stethoscope. So let's do that. Make sure I don't hear anything. Also, and no bruits noted. So that's good. Let's see. I need to palpate the lymph nodes for size, shape, delimitation, mobility, consistency, and tenderness. So lymph nodes should be less than a centimeter. They should be soft and they should be movable. So I'm going to do the preauricular nodes, which are at the front of the ears. I'll check those. Good. No abnormalities noted. The postauricular nodes behind the ears. Nothing noted. Very good. The occipital nodes, which are at the posterior base of the skull, and I'm just feeling. And the tonsillar nodes, which are at the angle of the mandible on the anterior edge of the sternocleidomastoid muscle. Okay, very good. Also the submental nodes, a few centimeters behind the tip of the mandible, and I'm just going to use one hand. Okay. And the superficial cervical nodes, they are superficial to the sternomastoid. So, right in here. Okay, very good. Then the posterior cervical nodes, which are near the trapezius, all down in here and down. None of that. Okay. Then the deep cervical chain nodes, which are deep within around the sternomastoid muscle, and the supraclavicular nodes, and I'll have to hook my fingers over the clavicles and feel deeply between the clavicles and sternomastoid muscles. So, all down in here, and here, and then here. No tenderness anywhere, right? Okay, good.